Hi everyone, I'm Dr. Julie Davis and I wanted to come on and talk about our office because we have officially been open for 2 full months since our COVID-19 closure. For 10 and a half weeks we only saw emergency patients, and now it's been 2 months since we reopened for normal patient care. Living through a pandemic has been a crazy and emotional experience for everyone. For example, this week was the first time I saw my grandmother, who I'm super close with, since March 6th. I mean, it is just a super trying time for everyone, and we're all going through it, but we're all, handling it differently, and everyone has their own comfort level about what's going on in the world. The most amazing thing to me has been the huge support we're feeling from our team and our community of patients. We had a soft opening on May 28th and 29th, and then on June 1st we opened our normal business hours, and since then we have been rocking and rolling. To prepare for our opening, Dr. Engert and I spent countless hours watching continuing education courses and discussing what our approach should be to reopening. In the end, we just decided to do everything that we could. We spent 2 full days with our team training on our new systems, and it definitely felt stressful in the beginning, but now it's been smooth sailing ahead, and it really feels good to be back. I want to share some of the accomplishments that we've had over the last 2 months, but first I really want to thank my awesome, amazing team and just say how grateful I am for them, because our training went well and we are all getting used to our new enhanced personal protective equipment. Now, that doesn't mean we like it, but we are definitely getting used to it. We're now wearing scrub caps, which were made by my husband's aunt, and they are so well made, and we are grateful to have them. We are wearing gowns, respirators, which are N95s or KN95s, all NEOSH approved, with a second mask over the top of that, and then a face shield. And this is all in addition to our normal personal protective equipment like scrubs, gloves, and magnifying loupes. Wow, is it hot. You might notice when you come in for your appointment that we're keeping the temperature a little bit lower as we get used to all of this new gear. I'd say the hardest part about the new gear is actually the face shield, but it's so important, and we're doing it and getting used to it over time. It's also not quite as personal entering a room with a patient with my mask and glasses on and everything, but all of the patients have been super understanding and just grateful that we're doing the best we can to keep everyone safe. During our training, we practiced the proper donning and doffing of all of this personal protective equipment. What that means is each clinical team member was trained how to put it on and how to take it off safely. And everyone's doing a great job, and we're able to keep our normal business hours plus some. One of our goals has been to minimize the number of patients in the waiting room and the treatment rooms for social distancing, and to do our best to only have healthy patients in the office. So we've implemented Curbside CheckIn. When you arrive at our office, you'll call to check in, and my patient coordinators will review the pre-screening questions, which are texted to the patient or emailed to the patient 1 hour before their appointment. If you haven't had a chance to answer them before your appointment, it's not a problem at all. The patient coordinators will review it when you call to check in. These questions are the questions that are recommended by the CDC and the ADA. They include: have you had a fever in the last 14 days? Are you having difficulty breathing? Do you have a cough? Do you have flu-like symptoms? Have you experienced recent loss of taste or smell? Have you been in contact with someone who's COVID positive, or are you COVID positive? And then there are 2 questions: are you 60 or older, and do you have any underlying conditions including heart disease, lung disease, kidney disease, diabetes, or any autoimmune disorder? And if the answer is yes to either of these last 2 questions, we inform the patient that they are more likely to contract symptoms if they are more likely to have symptoms if they contract COVID-19. The last question we ask is, have you traveled outside of Illinois? If the answer is yes to that question, then we follow up, were you practicing social distancing? Where were you? Things like that. If you don't answer these questions, with a no, then we have to follow up and make sure it's safe for you to come to your visit. In addition to these questions, when you enter the building for your appointment, the patient coordinators will take your temperature and a blood oximeter reading. If your blood oxygen level is 92 or lower, or your temperature is 100.4 or higher, we will reschedule your appointment for 2 weeks later, and we'll recommend that you contact your doctor. This is just because those readings can indicate that you possibly have COVID-19. The patient coordinators have been doing an amazing job with these questions, temperatures, and blood oxygen readings, and all of the patients have been super accepting of it, and it's been great. We also added tons of air disinfection. We have installed an air purification system on our HVAC unit called the iWave. It's an ionization system. We have air purification units with HEPA filters and UV sterilization in each and every treatment room, plus the waiting room and the conference room. And then we've put up plastic barriers between the treatment rooms to keep them separated from each other. While those don't look pretty, they're doing what they need to do to keep us all safe. These are some of the changes that we've implemented in the last 2 months, and our patients are feeling safe and our team is doing amazing. Dr. Engert and I are so grateful for all the support we're feeling from our community of patients, and we couldn't do it without our amazing and dedicated team. So with that, I want to wish you a great weekend because I'm recording this on a Friday, and stay well, and hopefully we'll see you soon at Davis and Engert Dentistry.